So, good day, folks. We are very, very excited to have Dr. Taheer Khan from Total Health with us in the studio today. He is a consultant radiologist at the Total Health facility in the Grand Pavilion, and he's going to tell us a little bit about himself. This is a bit of an introductory interview. So, he will tell us something about himself and what he does as a consultant radiologist. What does that involve exactly? Some very, very interesting things going on at Total Health. So good day, Dr. Khan. How are you?
Yeah, hello. Hi, Sandra. How are you? You're fine?
I'm doing good. Yes, absolutely. So
Yes.
help our viewers to get to know you a little bit. Tell us about who you are, really.
Yeah. Hello. My name is Dr. Taheer Khan. I am a consultant radiologist. I have joined Total Health, and I am basically from India, born and brought up in India.
Okay.
And I have done my master's in radiology. And post my master's, I was mentored by Professor David Cosgrove.
Mm-hmm.
David Cosgrove is one of the pioneers in ultrasound imaging in the world.
Oh,
He
wow.
he was the person who taught the world how ultrasound is done, and I have been mentored by him.
Mm-hmm.
And after that, I was working for almost 8 years. I have worked in a high volume multi speciality hospitals,
Mm-hmm.
including I have worked in the field of oncology, because oncology is one of the challenging part of an imaging field. So even I
Mm-hmm.
have worked in that oncology, and I am expertise in all the imaging modalities. I perform all types of ultrasound scans,
Mm-hmm.
reporting of all types of X-rays, CT scan reporting, MRI reporting, and also I do some non-vascular intervention in radiology.
So we're
So
going to get into what some of those things are because there's a lot
yeah,
of big words in there.
yes, yes,
Right?
yes,
So we'll
definitely.
break that down. But you make mention of being mentored by Professor David Cosgrove, who is a pioneer of ultrascans in the
Yes,
UK. So did
yes,
you go to the UK to actually
yeah,
understudy him, or how did that work?
yeah. I had been to the UK,
Hmm.
and there I have worked with him. I have been mentored by him,
Hmm.
and also apart from that, he had also come back to my country, India. He was in India for almost couple of months. So
Okay.
even I have worked at that time also along with him. So down the lane, you can say I have been mentored by him, and by may he be happy. In the last year he just expired, so may he be blessed always.
Oh, wow, interesting. So, in the field of these professional fields, medicine and nursing, it's quite something to have the opportunity to work with people who are known as pioneers or who have been, they're sort of the gold standard and they're the real experts with different things. So I'm sure
Yes.
you must have been very, very honored to
Yeah,
have worked with
definitely.
this professor. And you say that really he is the pioneer of ultrasound
Yeah,
scans in the UK. So
yes,
let's talk about the different types of scans. I've seen a very comprehensive list of all the different types of scans that your facility offers. It's a lot, first of
yeah,
all.
yeah,
I personally did not realize that there were so many scans available. My gosh, it's like everything. You mentioned oncology, like I hadn't really thought about that. There's thyroid scans, there's vascular Doppler scans. Oh my gosh, there's a whole list. So
yeah.
let us go through what some of them are, and then
Okay.
let's break it down a little bit so people can understand what those are used for.
Yeah. So ultrasound scans, I do all types of ultrasound scans. Let's start with one scan, that is abdomen
Mhm.
and pelvis. So
Yes.
abdomen pelvis scan is usually done. You can say number one.
Hmm.
If you want to see, we'll start by the organ wise.
Hmm.
So first ultrasound is done for liver. In the case of liver, in liver imaging, you can see if there is any changes in the liver of yours. You can see if there is any fatty deposition of the liver. You
Mm-hmm.
can see if there is any liver diseases which you get after being a chronic alcohol after 5 to 7 years.
Mm-hmm.
So these with pertaining to the liver, we can measure the size of a liver. We
Mm-hmm.
can measure how the liver is functioning on the
Mm-hmm.
basis of ultrasound, and then we can move on to the gallbladder. Gallbladder is also one of the very important organ of the body. It really helps in digesting the food. So, in
Right.
with pertaining to gallbladder, we see on ultrasound, we can see whether the gallbladder has any stone or no, and then
Mm-hmm.
we can see how the gallbladder, the wall of the gallbladder, we have to see that because in certain in most of the persons who have a chronic acidity problem, they will
Mm-hmm.
have some changes in their gallbladder, which can be diagnosed on an ultrasound imaging.
Wow. So
Yeah,
let me just say, we're going into the details of how an ultrasound can be helpful for different areas of the body, but we didn't actually tell our listeners, well, what is an ultrasound? Maybe there's some people who are listening to this who've never had an
yeah,
ultrasound done before. So
yeah,
let's just step back a little bit. Give us the
yeah,
most basic definition
yeah.
of what an ultrasound is.
Yes, ultrasound is mainly a device in which we send the ultrasonic waves
Hmm.
within the tissue of the body, and
Hmm.
those waves which pass inside the tissue and they
Hmm.
reverse back as they touch a surface and come back. Then
Hmm.
those are the images which we see on the screen.
Hmm.
And ultrasound has very minimal radiation exposure, because
Hmm.
these days we say that there are certain articles which are coming which are mentioning that getting a routine ultrasound is
Hmm.
could be harmful to the human body, but it is not that case. Ultrasound has very minimal radiation exposure, so any person who wants to get an ultrasound can get an ultrasound. According to
Hmm.
the latest articles, if a
Hmm.
person undergoes more than 465 ultrasounds,
Wow.
then only he will have a minimal risk on the body. It will be like itchiness over the skin. That is the
That's a lot
minimum.
of ultrasounds, though. Most people would probably
Yeah,
never.
yeah, yeah, yeah. Most people will never cross 465. That
Yes.
I can assure.
Yeah. So when we hear about ultrasounds, this is an actual, are there different types of ultrasound equipment or machines that
Yeah,
allow you to carry out an ultrasound?
yeah. We have different company machines which we use.
Hmm.
Now one of the best machine which we are using is a GE company machine,
Hmm.
and we have totally three probes. We have a high frequency probe, we have a low frequency probe. It's according to the wavelength of the frequency probe,
Right.
we do the scans. So every machine has an expertise, whereas we have the GE. It is one of the best in the world,
Hmm.
and we they are the pioneers in this ultrasound machine thing.
Right. And that's GE. We are familiar with the name, General
Yeah,
Electric.
yeah, yeah.
Yes, they make a
Yeah,
lot
yeah.
of medical equipment actually. So
Yes,
the abdomen and pelvis. So some of the more common scans then that you do for that particular area
yeah,
include looking at, you were mentioning the liver. Now, what
yes,
is the function? You said that someone is an alcoholic, for example,
yes,
they would have a liver that's not going to be in the best medical condition, and
yes,
that would lead to some sort of chronic liver disease, right?
yes, yes.
Um, how would someone know if they were having issues with their liver? What are some of the
Okay.
signs that could tell you something maybe is wrong with your liver?
Yeah, you can say that number one, that person will have a difficulty in digesting the food.
Mm,
Second, he will have pain in the part of a liver. You can say in the right abdomen pain,
mhm.
and you will see he will have sometimes swelling over the abdomen. And apart from that, these are the classic things which anyone can find out, right? You
Yeah.
will have a irritability, you will have a loss of appetite,
Uh-huh.
and you will feel more of a weakness, even though
Okay.
you had a recent meal, and after half an hour of the meal or 1 hour of the meal, you feel like I'm so much of tired, and all
Mm.
these are the classical signs of liver. So in that case you can come for an ultrasound,
Mm-hmm.
and in that ultrasound we see how is the liver appearances. I won't use the I won't use the radiology terms, which because it will be difficult to understand. I'll make it much more simpler.
Yes.
So it will be like every liver has a classical appearance which we see on the ultrasound.
Mm-hmm.
So when the person comes who is an alcoholic, there will be change of the appearance. The liver will be a much more darker, you can say dark appearance,
Mm-hmm.
and there will be some changes on the surface of the liver.
Mm-hmm.
So those are the classical changes which you see in the ultrasound imaging, and we have different grading for that, which has been prepared by American College of Radiology.
Mm-hmm.
So in which we can say that how is the liver. You can say in the simpler terms, like how is the liver damage? Is it grade 1, grade 2, or grade 3?
Mm-hmm.
So accordingly, we can categorize also.
Mm-hmm.
So this is how the liver imaging will be really helpful if you get it done on the ultrasound.
Right. So your expertise then is not just in conducting the ultrasound scan, but do you then read and interpret the results from the
Yes,
ultrasound? Yeah.
yes, yes. One of the most advantage is I perform the scan
Mm-hmm.
and I get the images, and then I myself will diagnose the disease
Mm-hmm.
and give a detailed report. My way of approach has been
Mm-hmm.
always that I give a detailed report with with even minor to minor measurements, so that
Mm-hmm.
and even the person who comes for me for scanning, if they want
Mm-hmm.
to know the detailed explanation, I even explain them the reports.
Mm-hmm. Right. And this is important because, in a lot of other facilities, you have less qualified people conducting the scan, and they're not necessarily the same people who will then review it and prepare the report.
Yes.
So,
Yes.
very
Yes,
interesting.
yeah. I have seen in this scheme that most of the centers they have less qualified doctors, less
Mm-hmm.
qualified you can say sonographers,
Mm-hmm.
and they do a scan, and
Mm-hmm.
those images are sent to some radiologists sitting way back in some other country like
Mm-hmm.
States or America somewhere, and that person is going to see the image and make a diagnosis, which is really difficult. You can't diagnose until you see it by your own eyes, until you do it by yourself. That is one of
Yes.
the most advantage stuff.
Okay. And you also mentioned that the abdomen and pelvis area also contains the gallbladder. So that's
Yes.
another organ that you could potentially be using that
Yeah.
type of
Yeah.
ultrasound for.
Yes, gallbladder also is one of the important
Hmm.
because it helps in digesting the food with the help of bile. So gallbladder, most of the person who have a chronic acidity issue, which have a difficulty in digesting, or which have a pain at the center of the abdomen, it
Hmm.
usually goes in the matter of gallbladder stones.
Hmm.
So with that stone, whether you have a stone or you don't have a stone, it's the ultrasound which can tell you with confirmation that
Right.
whether the stone is there or no. Plus, apart from
Hmm.
that, we can also tell how is your gallbladder functioning, whether
Hmm.
it is perfectly fine or whether there are certain changes which has happened. Because if a person is a chronic alcohol, if he has a grade 2 liver disease, then there will be at least 20% effect on the gallbladder it also.
Hmm.
So that is also one of the major criteria for gallbladder imaging.
Right. So I was quite excited to see that one of the types of ultrasounds that you perform is actually pregnancy related.
Yes.
Ultrasound, which includes the early pregnancy test, the NT scan,
Yes.
abdominality scans, which I think is very, very important, and
Yeah.
also the month to month growth and
Yes.
progression. of the fetus, and the Doppler 3D
Yeah.
trimester scan. So these are really important. I think anyone who's had a baby knows
Yeah.
the importance of being able to see how the child is progressing in the womb and how
Yeah.
the pregnancy is coming along, because it can alert you to any areas of concern
Yes.
early on in the pregnancy, and if that
Yes.
can be sort of offset or
Yes.
mediated in some way, it's important to have that information.
Yeah, definitely. Yeah, pregnancy, getting a pregnancy scan is one of the most important.
Hmm.
Like, we have different types of pregnancy scan.
Hmm.
I would like to tell you in a very short discussion about this.
Yes.
So, pregnancy, there is one early pregnancy. Whenever you get a positive on your pregnancy strips,
Hmm.
so what you can do is immediately you can come for an ultrasound with full bladder. You need to drink 4 or 5 glasses of water, and you should get an urgency to pee. So once you come, we can do an ultrasound of yours with early pregnancy, and we can tell you like whether you are pregnant or no, because on ultrasound we can confirm with the basis of gestational sac, on the basis of the size of the endometrium. So this is one of the important of early pregnancy
Hmm.
scan. And after early pregnancy, the next type of scan is called NT scan. It's called nuchal translucency scan. This is
Hmm.
one of the scan which we usually do in when you are at 3 months of pregnancy. That is around 12 weeks of pregnancy. In this, what we do is we measure the nuchal translucency of the baby. So, what is the advantages of this scan is in this scan, on the basis of the measurement of nuchal translucency, we can overrule many of the syndromes. There are certain syndromes like Down's syndrome, there is
Hmm.
Edwards syndrome. These are the classical genetic defects which usually comes in a history, which comes in a family history. So that we can rule out when it is 12 week of scan. And after that, the next scan is that is at the 5 month scan. According to the latest guideline, it is around 18 to 22 weeks. You
Hmm.
should get a scan which is called anomaly scan.
Hmm.
Anomaly scan is that scan which usually we see the baby complete
Hmm.
from the head till the toe. So we see how is the baby's head. Is
Hmm.
it in the proper shape? How is the eyes of the baby? How is the nose? How, because we can rule out certain deformities like cleft lip, cleft
Hmm.
palate, and we can see how are the ears developed. I can tell how is the spine of the baby, whether it's proper, how is the heart of the baby, whether heart is perfect, and what
Hmm.
about the stomach, what about the organs of the baby, how are the hands and legs developed, because there are certain cases which have been reported where the babies might have one hand short. So
Hmm.
even we can diagnose with 100% on ultrasound that
Hmm.
how is the baby growth and all everything, like how
Right.
is the whether the baby has any anomalies or no, the baby is perfectly fine or no. And
Hmm.
after once you complete the 5th month, then every month you should undergo a scan which is called a growth scan. growth
Yes.
scan growth scan in the sense is every month a lady should come to me for scan, and i can
Hmm.
i can measure all the basic parameters, and I can tell you how is the baby growing,
Hmm.
whether it's growing up to mark or whether it's growing below mark, or whether it's
Yes.
growing a wonderful growth.
Absolutely. And
So,
I have a little bit of personal experience with this actually, because my daughter, unfortunately, was growing very, very small.
oh,
So she was a preemie, and it guided the obstetrician in decisions that he had to make. And I
yeah,
must tell you, she's perfectly fine. But at the time, they weren't sure, what was causing the slow growth.
okay,
And at 8 months, essentially, my OBGYN made the decision
yeah,
based on what you just said, that
yeah,
scan at 8 months, is she in this percentile compared to other babies at 8 months?
yeah,
And he made what I thought was a really good decision to say, at 8 months, neonatal unit can take care of this baby perfectly
Yes.
fine.
Yeah.
And it was in her best interest to go ahead and deliver the baby early by cesarean.
Yes. Yes.
He essentially said the last month, the gains that you might, have in terms of her growth at this point, we think will be very minimal, but
Yeah.
the risk would be tremendous.
Yes.
So it's
Definitely.
important for women in particular throughout their pregnancy to have this information,
Yes.
because in conjunction with their, OBGYN and other specialists that might be needed, it can
Yes.
help guide them with important decisions that they need to make. And the earlier you can make a decision, probably the better.
Yeah, yeah, yeah.
Yeah.
Yeah, that's fine. You should always do
Mhm.
a proper scans, especially in the pregnancy every month. So we will
Yes.
have a complete picture of the growth of the baby, how is
Mhm.
it doing and all. And there is
Mhm.
one more scan which I do, that is a Doppler scan, Doppler in the pregnancy scan, which
Yes.
we usually do when the when it is 7 month onwards. So what is the advantage of this Doppler scan I do is, if there is a certain pregnant ladies will have a family history of diabetes,
Mm.
or you can say if they have a history of
Mhm.
hypertensive, which we say a condition called preeclampsia and
Preeclampsia.
eclampsia.
Yes.
Yeah,
Okay.
so in that cases, I do Doppler scans, because in the Doppler we can tell exactly how
Mhm.
is the growth of the baby, how is the blood supply to the baby,
Mhm.
how is it growing up to mark, or whether there is some effects of the gestational diabetes or blood pressure on the baby.
And the
These
baby.
things we can do on the basis of
Mhm.
measurement of certain blood vessel. We
Mhm.
measure the blood vessel measurements and all. So that is also one of the most important Doppler study which we need to do.
Mhm.
If you have if there is someone who has a history of diabetes, or
Mhm.
or hypertensive, then they
Mhm.
should get a Doppler scan done.
Yes.
Yeah,
Wow. So that's quite a few options there for women who are going through pregnancies. Now, what about breast cancer patients? We do know that ultrasound is very, very important. Early detection, they know for sure,
yeah.
with all cancers, but especially with breast cancer, really saves lives. So, how are ultrasounds useful then with the early
Yeah.
detection of breast
Yeah,
cancer?
yeah. Breast cancer is one of the 13% overall cancer rate in the Western world.
Mm-hmm.
So breast cancer is usually, we need to do a routine screening.
Mm-hmm.
So while you are doing a breast scan, there are certain different categories which we can divide. One is a breast scan for patients who have a history in the family history, who have a breast cancer in the family history. In that cases, we can do a breast imaging. In the breast imaging, what we do is we see how the breast tissue is, how is the areola, how is the nipple, how is the breast architecture, and if there is any swelling, we can, on the ultrasound we can tell you exactly what is the size of the swelling and how is the swelling, whether it is a solid or whether it is a fluid one swelling. And the most important is we can do a grading of, that is called Biorides is a grading which is done by the American College of Radiology. That is a grading system which we use for ultrasound imaging of the breast mass lesions. So in
Mm-hmm.
this we can tell you that what is your grade. It's grade 0, 1, 2. These are the three grades where you can say, even grade 3 where you can say the mass lesion is non-cancerous,
Mm-hmm.
whereas grade 4 and 5 is a cancerous lesion. So on the basis of ultrasound we can tell you whether your swelling is cancerous or not cancerous. This is one of the most advantage of ultrasound imaging, because once you know the early detection of the lesion, then you can get the maximum treatment and you can get yourself fully recovered with that.
Right. So the ultrasound is different than the traditional mammography?
Yeah.
Ah,
Mammography is a different, and
uh-huh.
ultrasound is a different modality. Mammography is more like an X-ray procedure,
Mm-hmm.
where we take multiple images of the breast tissue, whereas ultrasound is that we use the sonic waves and get it done. So sensitivity wise, ultrasound has a better sensitivity.
Mm-hmm.
Mammograms have less sensitivity. But if there are certain very minimal lesions, like, even if it is minimal, very small swelling also we can see on ultrasound, whereas we can miss those on mammograms.
Mm-hmm.
Whereas according to the latest guidelines, it's always ultrasound to be done.
Mm-hmm.
And even on a normal female patient, I would suggest that every 6 months six
Mm-hmm.
months once you can get a breast scan done,
Mm-hmm.
just to be on a safer side always.
Okay, so you can do, because I know mammography is recommended depending on your risk level every few
Yeah,
years. It might be
yeah,
annually if
yes,
as you
yes,
get up in age and so on. But an ultrasound is a lot safer, so you can do it
yes,
more often.
yes. Ultrasound is safer because it has minimal radiation,
Right.
whereas mammogram you will have a more radiation.
Mm-hmm.
And you should always try to minimize the radiation exposure. So
Mm-hmm.
I would always suggest that ultrasound is the best modality for
Mm-hmm.
the breast scans.
Okay. Wow. So another area of interest that people can get scans on, which is quite interesting, we don't think about this one a whole lot, but are your eyes. So
Yes.
when would someone need an eye ultrasound? When would that be required?
Yeah, eye scan is one of the scans which I do.
Mm-hmm.
What is how Now many one will be thinking, how do you do an eye scan? Because
Yes.
usually we tell the person who comes with a history of trauma, like you have some hit on your eye, or
Mm-hmm.
you have some redness in the eye. So we do a scan where we tell the patient to close their eyes,
Mm-hmm.
and with the help of a probe, we just put on the eye, and we can see whether there is any hemorrhage,
Mm-hmm.
corneal hemorrhage, or is there any retinal injury, or whether there is any injury to the lens, and how is the eye architecture. That we can definitely know by B scan.
Mm-hmm.
Eye scan is a term which is called B scan.
Mm-hmm.
So anyone who has an injury to the eye, who has a swelling in the eye, and who want to know how whether my eyes are doing proper or no, then they can definitely come to me for a B scan, and I'll be the best to explain you the details.
Amazing. All right, so let's talk then a little bit about the non-vascular intervention. So explain to me first, what does that mean? What is non-vascular interventions?
Non-vascular intervention is an intervention which a radiologist does, which does not involve puncturing any blood vessels,
Uh-huh.
which does not involve any changing the size of the blood vessels. Now, non-vascular interventions is like the investigations which I do is, like, for example, you have a liver abscess.
Yes.
So now the medicine doctor is giving the medicine, and it is not drying up. So
Mm-hmm.
what we can do is, through with the help of ultrasound, I can take a pigtail catheter, and I can, with the help of an ultrasound, I can go exactly in the same area where the abscess is. I can put that catheter. Catheter is more like a pipe. I can exactly put in that abscess the pipe, and we can easily drain it out. So
Mm-hmm.
in that way, the abscess will be drained, and obviously when there is no fluid, so the patient will be recovered very soon, and even medicines will dry up the remaining ones.
Mm-hmm.
So that is one intervention, non-vascular intervention, which I do. There is another intervention. You can see there are certain people, especially in this COVID era, where you can say that they will doctor says that there is some water in the lungs. In the lungs you have some water. Now they usually, a medicine doctor tries to drain it, but he finds sometimes difficult. So in that
Mm-hmm.
case, we being a radiologist, we, with the help of ultrasound, I can mark a point and I can put a catheter and I can get it drained. So that is one. Yeah, and there is one more. We say it as a ascites. Ascites is where you have a fluid accumulation in the stomach, in the abdomen. It usually is seen in the grade 2 to 3 liver disease in a patients who are alcoholic. So in that case, when you want to drain the fluid from your stomach, you need to be very careful, because when you want to inject the injections, so you have to see whether you shouldn't damage any of the organs. That's why with the help of ultrasound, I can exactly go to that area which doesn't have any of the organs, and I can just remove the fluid from that. That is one of the uses of an ultrasound guided ascitic typing, which we say. These are the some specific. Even if you have some swelling in the neck, you have some swelling in the neck, you want to see what exactly the swelling is, because there are certain doctors which might say you that we need to do one investigation in the laboratory about what exactly is in that fluid. In that case, we can just, on the basis of ultrasound, I can just put exactly in that area where the mass is, and then I can remove the fluid. This is one of the uses of an ultrasound guided non-muscular interventions.
Wow, it's a lot. Now,
Yeah.
folks, if you're just joining the interview, this is Dr. Taheer Khan, who's a consultant radiologist with Total Health, who located in Grand Pavilion on West Bay Road. They have a number of different services available. You can certainly contact them at 333-2222. Dr. Taheer Khan, I'm sure, is available for a consultant. He can tell you more one-on-one if radiology is the best exploratory option for you. If you have certain concerns about your health, he's an expert that can give you guidance on that. So, Dr. Khan, we know that you do a lot more. In another interview, we will definitely get into learning more about X-ray technology. But our audience, we have to give it to them in manageable bites.
Yes,
Small
yes,
bites, so that they can understand all of this
yes,
medical stuff. But I think it's an amazing time, really, to be alive, and it's an amazing time to have experts such as yourself who
yes.
can offer this degree of expert knowledge and information, and who are very willing to come on our program here and share it, with our listeners and our viewers, because this is such
Yeah.
important information. So thank you so much.
Thank you, thank you, thank you, Sandra. Thanks a lot.
Yes,
It was a pleasure to talk to you. Since I
yes,
have come to Cayman,
absolutely.
I have heard that you need to always talk to Sandra.
Oh,
So
really?
it's my pleasure to meet you and talk to you. Thank you. Thanks
Thank
a
you
lot, Sandra.
so much. And we will definitely have you on again to
Sure.
find out more about what you do at Total Health. So, folks, it's, your health care, taking control of your health is very, very important. These things matter. And we always encourage you to speak to your physicians. There are a lot of experts like Dr. Khan out there who can, they're a wealth of information, and they can certainly address any concerns or issues or, any questions that you have. And the sole purpose of these programs is to try to educate you so that you know what services are available, where you can go for these different options. So we're very, very grateful to Total Health for providing this expert knowledge. We know that we've had their nutritionists on before. They've participated in our COVID special. And so we will continue to bring these very informative discussions to you, the general public. So again, big thanks to Dr. Khan, big thanks to
Thank you.
Total Health, folks. And we'll see you at the next session. And please enjoy the rest of your day.
Thank you. Bye bye.